All right, let's dive in. Today, we're going to try and crack a medical mystery that has puzzled doctors and patients for decades: the intense, unpredictable, and so often misunderstood pain of endometriosis. We're going to piece this puzzle together one clue at a time. So, right at the center of this whole thing is a paradox that is, well, it's truly baffling. It's a question that pretty much challenges everything we think we know about how a physical disease should connect to the pain that it causes. I mean, think about this. It's such a strange contradiction. On one hand, you could have someone with just a few tiny endometriotic lesions, but they're experiencing absolutely debilitating pain. And on the other hand, you could have someone with widespread, severe disease that's found during surgery, and they report no pain at all. It's become so clear that the level of pain just doesn't line up with what doctors can see. So what is really going on here? Okay, so first, let's get on the same page. At its core, endometriosis is an inflammatory condition. It's all about this tissue, which is a lot like the uterine lining, growing in places it's not supposed to. These growths are what we call lesions. But here's the thing. If the lesions themselves aren't the whole story, we've got to look deeper, right? So, our investigation starts with clue number 1. This is about way more than just the physical lesions themselves. See? These lesions, they're not just sitting there doing nothing. They are active biological factories. They are constantly pumping out a powerful mix of inflammatory signals into the area around them. And what you get is this, well, it's basically an inflammatory cocktail. You've got things like interleukins and TNF-α, which are known to fire up pain pathways. But maybe the most crucial ingredient here is something called nerve growth factor, or NGF. And this is a huge piece of the puzzle because it does exactly what you think. It tells new nerves to grow. And here's what that does. That nerve growth factor causes new nerves to actually grow right into the lesions themselves. This means that endometriotic tissue has a way higher density of nerve fibers than normal tissue. And more nerves? Well, that means more phone lines for pain signals to travel on. In fact, studies show a direct link. The more nerves you have, the worse the pain. So our first clue is that this whole area becomes inflamed and literally gets wired for pain. But the story doesn't just stop there, not even close. So for clue number 2, we need to zoom out a bit because this local problem can quickly blow up into a system-wide issue. We're talking about a sensitized nervous system. Okay, to really get this, let's use an analogy. Imagine your nervous system is like a super sophisticated fire alarm system. It's designed to warn you about danger, which in this case is tissue damage. But what happens when that system gets bombarded, day in and day out, by pain signals from endometriosis? Well, it starts to go haywire. The first thing that goes wrong is something called peripheral sensitization. This happens right at the source. All those inflammatory signals make the local nerve endings incredibly twitchy and hyper-responsive. It's like your smoke detectors are suddenly so sensitive, they start screaming just from the steam from your shower. Something that should be totally harmless is now triggering a massive alarm. And from there, things can get even more serious. This is where we get to central sensitization. Now the problem has moved up the chain of command, all the way to the spinal cord in the brain. The central nervous system gets so used to getting these emergency pain signals that it rewires itself. It goes into a permanent state of high alert and starts amplifying the pain signals. So now it's like the main alarm panel for the whole building is just stuck. It's stuck in the on position, just blaring constantly, even if there's no smoke at all. So you can see how this escalates, right? It all starts with that initial trigger, the inflammation from the lesions. That leads to the local nerves getting rewired and becoming super sensitive. Then, over time, this central nervous system itself adapts and learns to turn up the volume on all pain. And eventually, this state of high alert just becomes the body's new and very painful normal. And get this isn't just a theory. We can actually see this happening. Brain scans using fMRI show real physical changes in the brains of people with endometriosis pain. We're talking about less gray matter in the parts of the brain that process pain. And even crazier, there's more connectivity between those pain centers. They're chatting with each other constantly, even when the person is just resting. I mean, the brain has literally rewired itself to be in a state of pain. Okay, this brings us to our third and final clue, and it explains why the pain so often feels like it's spreading. We can think of it as pain's ripple effect. This whole thing is called cross-sensitization. Basically, all the organs in your pelvis are packed in there pretty tight, and their nerve pathways all meet up at the spinal cord. So, when you have a constant distress signal coming from one organ, like the uterus, those signals can kind of spill over and make the nerves of its neighbors, like your bladder or your bowel, super sensitive too. It's like having crosstalk on an old busy telephone line. The signal from one conversation just bleeds over and messes up another. And that is why so many people with endometriosis also end up with other pain syndromes. This cross-sensitization idea is thought to be the key reason why conditions like bladder pain syndrome or IBS are so common. It's not like these are all separate, unrelated problems. Nope. It's a direct result of the body's wiring getting all crossed up. I mean, just look at this number to see how real this connection is. Some studies show that the rate of irritable bowel syndrome in people with endometriosis is as high as 60%. That is a huge overlap, and it's all driven by the shared sensitized nervous system. Okay, so now we have our 3 clues. Let's put them all together and finally solve this puzzle. And it really requires a whole new way of looking at pain. And the answer, when you boil it all down, is this. Endometriosis-associated pain is not just a local problem happening at the lesions. It is a complex, system-wide condition where the nervous system itself has become a generator and an amplifier of pain. All right, so let's recap. What did we find out? We learned the source of the pain is way more complex than we thought. It's the lesions, the inflammation, and all those new nerves. We saw how the nervous system itself adapts, with sensitization turning the volume way up on pain. And we uncovered how that pain can spread, like a ripple effect, to nearby organs. And that finally solves our puzzle. The reason the amount of disease doesn't equal the amount of pain is because the pain level is ultimately set by the sensitivity of the nervous system, not just how many lesions someone has. So what's the big takeaway here? It means that just surgically removing lesions, while it can be really important, might not be enough. It doesn't fix the sensitized nervous system. Real, effective management has to be multidisciplinary. It has to address the rewiring in the brain, the hypersensitive nerves, the whole shebang. And that really leaves us with one final and I think really important question to think about. If we understand that chronic pain is a condition of the nervous system itself, a system, not just a symptom, how should that change the way we treat it? Not just for endometriosis, but for all chronic pain conditions out there. Thanks for joining us.